Good morning, everyone, and thank you so much for being here today. I wanted to chat with you today to talk about the city priorities with regard to federal funding, the federal funding that we've received through the CARES Act, CDBG, ESG, FEMA, and other federal grants. I know that was a lot of acronyms. We know the toll that COVID has taken has been so great. We will use these funds in three main categories: health, humanitarian, and business. This pandemic is likely to be a massive long-term problem. 41 million Americans have lost their jobs. And we know that those jobs fall primarily on the shoulders of folks who were already just making it and are vulnerable to any interruption in their income. Federal and state unemployment will run out, but our people will still be suffering. Spending priorities that we're announcing today, we hope will help ease some of that difficulty. These historic investments are going to be made to address not just the devastating public health impact of this virus, but also the astronomical economic and humanitarian fallout that's threatening our fellow St. Louisans. As I know you probably remember, back on May the 6th, the city received $35 million from the state of Missouri through the CARES Act. These were emergency relief funds from the federal CARES Act designed to provide support to protect workers, families, and businesses. Frankly, we should have received $17 million more had we received the same amount per capita that St. Louis County received. But we are continuing to work with the state to try to get those additional funds to benefit our people. The City of St. Louis residents should certainly receive the same amount as those residents in St. Louis County. We know that this global pandemic will have devastating effects on our residents and businesses for both the short and long term, as I mentioned. We must be intentional and deliberate and thoughtful in recognizing our COVID-19 related hardships are not going to go away overnight. It will be felt in every corner of our community for months and likely years to come, especially among high-risk, vulnerable populations that have already been disproportionately affected by this virus. I do want to introduce today the people that are here with me because they have worked extremely hard to put together this comprehensive package. And I'll start on this end here. Steve Conway, my chief of staff; Otis Williams, Executive Director of St. Louis Development Corporation; Judge Jimmie Edwards, just a little behind me here, Public Safety Director; Valerie Russell, I skipped over Will. Will Pinkney, sorry, you were out of order on my speech. Will Pinkney, Director of Children, Youth, and Families; Valerie Russell, Director of Human Services; Dr. Fred Echols, Director of the Health Department; and Matt Moak, Executive Director of the Community Development Administration. Next week, we will be asking the Board of Aldermen to consider the priorities that I'm going to talk about right now. This is an appropriation of $64 million in COVID-related assistance for the people of St. Louis. That $64 million includes the CARES Act funding, the CDBG funding, FEMA funding, ESG funding, and a few other grants. In sort of a snapshot here, the health department will get directly about $7 million for increased staffing and technology for contact tracing and disease investigation. Also included in that $7 million is support for early childhood education, assistance for the federally qualified health centers for telehealth, housing assistance for people living with AIDS. The Human Services Department will get about $18 million because we know that skyrocketing unemployment threatens to force people and families from their homes. So to address this looming housing crisis, which really hasn't even hit us yet because some people are still on unemployment and still have some income levels. But it includes more than $5 million for rental and mortgage assistance, $3 million for utility assistance, $2 million for rapid rehousing assistance. Also, additional funds for prevention of homelessness. And last category, small business. The stay-at-home order was so devastating for our small businesses. Many of them have been closed for over 2 months and have laid off their workers. We will invest $4 million in small business support through St. Louis Development Corporation. To businesses, small businesses, primarily those 25 businesses and under who have been significantly impacted by the disruption. We will also prioritize those businesses that are in already federally designated areas, which are our most distressed areas. And lastly, in the categories here, of course, we're going to spend a significant amount of money, almost $12 million, on personal protective equipment, PPE, on tests, test kits, test supplies, on cleaning, on sanitizing, and on our facilities to keep folks safe. We know that in the absence of a vaccine, we have to have this expanded testing. We have to test more people more often. We have to make PPE more readily available. That's masks, it's gloves, it's gowns, it's shoe covers. It's all of the things that folks need to keep themselves safe. So those additional funds and the test kits, we're spending over $2 million on test kits alone. That doesn't even include the processing of that, which is done by the labs, in order to make sure that we have tests available for everyone who has symptoms and for everyone who needs to be tested, even folks who are asymptomatic. As those of you know, we started out on this process a couple of months ago, and we didn't have tests, and we didn't have swabs, and we didn't have what we needed to do that testing. We have finally broken loose some of the log jam on that, and we have test kits. But now, of course, we need the capacity, the whole system needs the capacity to process those test kits. So as we move along this continuum, we continue to work through, and when I say we, the big we, the city of St. Louis County, and the region and the state, continue to work through the components that are needed in order to allow us all to coexist with COVID. Coexisting with COVID until hopefully there is a vaccine. 100,000 Americans have lost their life to this deadly virus. And the funds that you are hearing about today are those funds which we hope and expect will assist those folks who have been and will be hardest hit by this pandemic. And with that, I'll be glad to take any questions.
Public radio is watching remotely, Mayor, and a question from St. Louis Public Radio. How does the mayor plan to work with the alders, I'm guessing they mean the Board of Aldermen, in regards to the funding plan, and will they have a role in developing the plan?
They will. We're going to present our plan to the Board of Aldermen early next week, ask them to take a look at that plan. Of course, it will go through the normal hearing process. We think we've done a good job of outlining programs that are needed both for people and for business and for health in terms of testing. But of course, we work with the Board of Aldermen and take their opinions into consideration so that we can come together to have one bill which will benefit the people of St. Louis.
Another question from Public Radio. What portion of the $7 million that is going to be allocated to the health department goes to contact tracing? How many new hires are planned?
About 25 new hires are planned, but also additional technology is planned for contact tracing. The total amount is about $2.5 million. About $2.5 million. I'm going to check my number here. So, Thank you all. Appreciate you being here today.